Hi, welcome everybody. My name is Amber King. Thank you all for joining us from all over the place. It's amazing to see what parts of the country you guys are from. I know people have been in our YouTube stream waiting for an hour and a half. So thank you everybody, it's amazing. We are also joining you tonight from Twitch. We are on Periscope and several places on Facebook. So wherever you are joining us from and social media land, please hit the like button, hit hearts, make some comments, and share with your friends and family, and make sure you have these important conversations about what your takeaways are here in this space. So I am the Our Revolution Washington State Secretary. I am right on the Snohomish-King County border. I have a background in healthcare, billing, public health as well. So I've been more on the administrative side, so I can explain all these awesome copays and deductibles. I am going to give a brief land acknowledgement and then introduce the rest of our amazing panelists tonight, and then we'll get started. So I thank you again for joining us, and we will have Q&A at the end. So please enjoy and think about how this impacts your life. But first, I want to acknowledge our First Peoples. Our revolution and whole Washington acknowledge that we are on the homelands of Native people who have lived in this region for time immemorial. Currently, there are 42 tribes, 35 of them federally recognized, that share traditional homelands and waterways in is what now Washington State. Some of these are nations and confederacies that represent multiple tribes and bands. Our coalition expresses its deepest respect and gratitude towards these original and current caretakers and healers of the region. We acknowledge our responsibility to establish and maintain relationships with these tribes and Native peoples in support of tribal sovereignty and their inclusion of their voices and traditional way of life. We also pledge that these relationships will consist of mutual trust, solidarity, and reciprocity. Thank you for having us on your land tonight. So I would like to introduce our amazing panelists. Rhonda, would you like to say hello?
Welcome, Rhonda Walker, Chair of Our Revolution, Washington Bernie Kratz Coalition here. I'm just here to help out tonight. I'm gonna help bring in some questions and kind of monitor the chats and stuff out there. So don't hold back, ask away.
Awesome, thank you so much. Sean, would you like to introduce yourself?
Hey everybody, I'm Sean Kavanaugh. I'm campaign manager of Whole Washington. I live in the great city of Seattle, and by day I'm an electrician apprentice, and in the evening times I'm trying to organize to get universal health care for the state of Washington. And I'm really happy to be here and happy that all the panelists were able to show up, and I'm looking forward to the conversations that we're going to have today.
Awesome, thank you so much. Elaine, would you like to say hello?
Hello, my name's Elaine Waller-Rose, and I'm kind of an outlier here. I'm not representing a organization, although I've been involved with some of these organizations. My background, I am a clinical social worker and a psychotherapist who's working in private practice here in Seattle. I've also worked in community mental health and schools. Worked with a variety of people of all kinds of income levels and dealing with all kinds of circumstances. I'm also human. I have a body, so I have a lot of experience with healthcare and a lot of concerns about the needs that aren't being met. So I came here because I watched a movie and was motivated by that.
That is perfect. That is exactly, you are a healthcare hero. So you're esteemed guest tonight. So thank you for all you do and have done. So thank you. Melinda, would you like to introduce yourself?
Sure. Hi, everyone. It's great to be here with you tonight. My name is Melinda St. Louis, and I am the Director of Public Citizens Medicare for All campaign. I'm based in Washington, D.C., and so the other Washington, and really thrilled to have the opportunity to talk with all of you tonight.
Thank you. And Stephanie, so excited to have you with us.
Thank you so much, Amber. Hi, everyone. I'm Stephanie Kang. I'm the Health Policy Advisor for Congresswoman Pramila Jayapal, the representative of Washington's 7th District, who I will note just won her district with a 60% margin. Incredible. And is also the lead sponsor of the Medicare for All bill in the House of Representatives. And I've had the honor and pleasure of working with your coalition and also Melinda every single day for the last 2 years fighting for Medicare for All.
Awesome. Congratulations. I also saw that you are a PhD candidate this year. Did you?
Oh, yes, I am defending in a few weeks. My defense is actually on Medicare for All, and hopefully everything goes smoothly. But yes, doctor in public health.
that gives me goosebumps. So he'll have to come back and let us know how it went. I'm so excited. Congratulations. So so we are here. I would like to give everybody kind of the introduction time to tell us. Obviously, we have people here with programs, and I'm going to let Melinda go first because she is joining us from the farthest away, and it's very late. And we appreciate you so much coming on here to talk with us. Tell us more about Public Citizen and your role nationally and how that can impact us in Washington state and in other states, because we have people joining us from all over the country, from Vermont to Colorado to Alaska, where everybody's all over the place, Texas.
Great. Well, thanks again, and welcome to everyone. I'm really thrilled, and it just shows just how much enthusiasm there is that there are people joining on a night like tonight with there are some other things going on. So really, I think it really speaks to just the energy and the urgency, right, of the work that we're doing to push for healthcare. Public Citizen is has been around for nearly 50 years, and we are a consumer rights organization and a people's lobby in Washington. We have a litigation group that that sues the government and corporations on behalf of consumers, and we work on a host of public interest issues, from financial regulation to environmental policy to global trade policy. And the lens that we work on all of these issues is really challenging corporate power in our democracy, and challenging especially the outsized influence of money in our democracy. And there's no issue where it's more clear than in healthcare that we have a completely insane, cruel, broken healthcare system that makes absolutely no sense unless the goal is to enrich the few, right? We have some of the best, we have some of the best doctors in the world. We have great medical institutions. You can get great healthcare in our country, but only if you are wealthy enough to be able to pay for it, or you're lucky enough to have health insurance. And the reason it's cruel for that reason, but it's also completely insane because it actually costs far more than if we had a more efficient system like a Medicare for All system. And so that's the reason that Public Citizen has been engaged in this issue since our founding in the 70s, and have been supportive of single payer healthcare. And about 2 years ago, we decided that it was really time to really invest resources, not just in the research, because we knew we were right on the arguments, and we have a lobbying arm that does lobbying in Washington, D.C. on healthcare policy, and my colleague Egan Kemp, who's our health policy advocate, have been working for years. But what we know is that we will only win this if we build a massive, massive grassroots movement that is able to challenge the enormous influence of the insurance industry and big pharmaceutical companies that are spending millions and millions and millions of dollars to block any sane change, right, in our healthcare system. And so I started our Medicare for All campaign to really try to motivate our 500,000 members around the country to get more involved in the fight for universal health care, and to participate and to help build the movement with our allies across the progressive spectrum, with National Nurses United, Physicians for a National Health Program, our Revolution, obviously, and People's Action, Center for Popular Democracy, Indivisible. We really want to kind of build this movement and to really bring more labor organizations into it, racial justice organizations that have been at the forefront of fighting for healthcare as well. And so we're really that's been the focus of my work. We are trying to, one of the infrastructures that we have built, and I'd be happy to talk more about it, is a way to plug people in at the very community grassroots level. We have a toolkit to pass local resolutions in support of Medicare for All. I know this is something that in Washington State has been done around some of the state legislation as well, but to plug people in at the local level to do the grassroots lobbying to their congressional delegation, but also to get their local officials really engaged in the work for Medicare for All. And I think what I was thinking, we're gathering right now, right in the midst, we have huge question marks about what strategy we're going to have going forward based on what the political landscape is. But I think what's clear, and I'm sure what's clear to everyone here, is that no matter who wins the White House or which party controls Congress, we have our work cut out for us on healthcare, and that we have to be building at the grassroots no matter what. So part of our strategy will be the same regardless, right, of the outcome of this election. but and part of that also, we're also facing a moment where in a matter of days, the Supreme Court is going to hear a case that's meant that, and very possibly could strike down the Affordable Care Act. People who have insurance, even though they have pre-existing conditions, are going to be could be in serious danger. All the folks who have received health care through Medicaid expansion, the exchanges, all of that will be at risk, potentially kicking millions more people off of their health insurance. So this is getting to be critical, and that's on top of, obviously, the COVID-19 pandemic, and the recession has kicked millions and millions of people off of their health care because we have an insane system that ties our health care to our employment in a time when people are losing their jobs around the country. And Congress has yet to actually help people on the health insurance coverage. It's an outrage. We are in the middle of a pandemic. People are being thrown off their insurance, and despite the CARES Act and other legislation, there has been no solution for people. So we're in an emergency. It's going to be getting worse, depending on the outcome of the Supreme Court case. And then, of course, we have the insurance industry and Big Pharma that are working to block any meaningful reform. And that's across the Democratic and Republican leadership alike. So my main message now, I think, in the weeks to come, we're going to have to be coming together and really strategizing after we know, the full situation that we're dealing with. We're lucky that we're going to continue to have champions like Representative Jayapal, Senator Sanders, who have strong bills that we can mobilize around. These are these are bills that are serious. They will, and we're happy to talk about. I think most of the people, my senses, are already strong single payer advocates, but and Stephanie, I'm sure, can talk more about what specifically in those bills if people want to know. But what we need to do is currently we have this fragmented multi-payer system that generates enormous administrative waste, has nothing to do with providing healthcare, and we have a healthcare system that the primary goal is to generate profit for private insurance companies. And what we will do through Medicare for All, when we get there, right, is we will eliminate all co-pays, deductibles. Any out-of-pocket costs will be completely eliminated for everyone at the point of service. And every single person in the United States will be covered. And we will do all of that by costing far less than what we're currently spending because of the massive administrative waste and profit making that is currently in our system. And I think the main thing that we need to be thinking about is how we build that movement. And so I do encourage everyone to go to, I'll put the website in the chat, but MedicareForAllResolutions.org has a map of more than 350 efforts all over the country of people who are mobilizing in their communities to pass these local resolutions, as well as we are also having monthly webinars and town halls. We recently had a town hall with Senator Sanders, Representative Jayapal, Representative Presley, and kind of an all-star panel in late September. I will also drop the link to that in the chat as well. Where we really were bringing together labor, business, and civil rights organizations, the Poor People's Campaign, to build this movement in a massive way. And we're really excited to be working with Holt Washington and Our Revolution Washington as part of that.
Oh, thank you. That, that is, all the things that you've mentioned are so vitally important and impacting all our lives. I know my healthcare was lost with my job for me and my children. And, so it'll be interesting to see what happens in the next couple weeks. And especially I would be impacted by pre-existing conditions as well. One of the issues that I have is that, say, Washington State, we're very progressive. We have had single payer Medicare for all healthcare in our platform for now 5 years and have gotten nowhere with the current Democrats in office. How do we push them away from the corporate influence that keeps them giving them more funds?
It's it's a huge issue that and I it's about building power. I think I think we don't have a shortcut around building the massive power that we're going to need. And I think one of the things that we talked about in this recent town hall with Senator Sanders and Representative Jayapal was, we have the arguments on our side. We have all the data. We have 250 economists from around the country saying that this is what we need to do financially. We have doctors and nurses saying that this is what we need to do for our health. We have, obviously patients and people are suffering all over the country. GoFundMe, people are using GoFundMe for healthcare. Nobody thinks this is working. Nobody thinks this is working. But the outsized influence of all of the money that's being spent into our political system. Public Citizen also has a huge campaign, Democracy is for People, that's about getting money out of our politics, which is, we have to be doing that on every progressive issue as well. But so that's a piece of work that we all have to be engaged in. But I also, I think we also have made tremendous gains, in the last 5 years, in pushing in Congress and pushing Democrats and pushing. We had a lot of leadership in the Democratic Party support Representative Jayapal's bill. We had hearings in the key committees of jurisdiction in the last Congress, or in the last year, which was, unheard of 5 years ago. And that is because of the bill, that's because we pushed this into the mainstream. We pushed this up into the Democratic Party. We have a long way to go, obviously. But we know the polling is with us. We know the American people, definitely the Democratic Party is. The polling is that upwards of 80-90% of Democrats support Medicare for all, and even majority of independents, and depending on how the question's asked, even Republicans support this. But we have to build the power so that especially Democrats who have been sitting on the fence and have not wanted to go against their donors, we have to make it so they know that they aren't going to be able to be reelected if they don't support this. So I don't think there's an easy way around it, but I think what you all are doing is part of that. And that's why we really are focusing very grassroots to get earned media at the local level, to get these conversations in local councils as well as state legislatures, so that it's not just activists, but it's, we have mayors coming on board, because it's actually these local officials who are seeing the impact. They're living the impact. They're seeing what's happening in their communities, especially in the context of COVID. So
absolutely. I know here in Washington, I think almost most LDs have signed resolutions in support of this 4 years ago, and we can't get anybody to bring it forward in the legislature to committee. They're like, oh, what about that other bill? That would, and total giveaway to insurance companies, every single time. So there's just, at some point, they have to be brave enough to actually help people. And that's what I'm trying to figure out, what is that tipping point? And for us right now, it's budgetary. It would save our state budget. We'd have no austerity cuts. It's a no-brainer. But I'm curious if there's any questions for Melinda, Rhonda, or anything that relates to this? I know everybody's just kind of, the chat I'm seeing is talking. So thank you guys for being so awesome and participating.
Yeah, I didn't see anything that was a major like question. It was more just reacting to all the things that were talked about. Some stories in here too. I mean, I want to make sure we connect with everybody at the end, because there are stories in here that need to be told. Again, we need to get these stories out, make them personal. Read through these if you guys haven't. I mean, from professionals, you know, dealing with it to regular everyday people.
And I would say, I think that that's a key piece. And we have got to tell all of these stories, and we need to make the media tell them, and we need to, you know, and we need to put them right in front of all of these politicians, because, you know, that is really what moves people, and what and will move policy. So I really encourage people. It can be a painful thing to like put your story of pain and suffering forward, but I think that is, you know, that's where a lot of our power lies too.
Absolutely. I know I definitely want to help people learn to tell their personal stories, because we all know somebody impacted with healthcare. I actually would like to hear from Stephanie. I have something that Melinda said that made me think of it was a program I participated in with Health and Social Services at a federal level. And it was called the business case of breastfeeding. And I'm wondering if we can make something like that work with single payer healthcare and universal healthcare. And it was going to talk to the most unlikely places, just regular people, giving them the tools to be able to tell their story and talk the money. So go into your union boss's office and tell them how much this would save, how much extra benefits they would be able to give their employees. That, you know, that just really getting everybody past those kind of fear points of that they're so afraid to give up such an expensive system that's failing so many of us. And I'm wondering, you know, especially with your public health background, what do you think, like some of the programs that have done like that are a little bit outside the box, do you think that would work for this?
Definitely. And I think the more outside of the box we can think, the better. And, you know, just to answer, I think this is all connected to the question of how do we get our politicians to represent our interests. And I think a part of that is really diversifying our constituency, our grassroots movement. We can't just build our grassroots movement within, you know, the movement we've built so far. We have to be bringing in different people. And like Melinda said, I mean, there's just such an overwhelming support for Medicare for all in this country, especially after COVID-19. Even almost half of Republicans, you're seeing Fox News saying that exit polls are showing 70% support government-run healthcare. Like they didn't even try to make it sound pretty, right? I mean, that's crazy. And so, you know, even just last year, the Commonwealth Fund, they produced a report that found that over half of small business owners support Medicare for all. And it's interesting, and they even write this in the report. They said, surprisingly, small business owners who are known to be much more conservative, right, support Medicare for all. And I loved seeing that. But I mean, it makes sense. It's exactly what you're saying. When you lay out the numbers, when you talk about this, perhaps without all the politicized labeling, it just makes sense. People want this. They understand. You don't really have to convince people too hard that the system is broken. What we have to try to convince them of is, what is the solution? Why does the solution require something as bold and ambitious and transformative as Medicare for all? And I think that's the message that we also have to deliver, right? This is the reasons why. I mean, the whole past century of health reform is the reason why incremental reform doesn't work, right? It just shows us exactly what happens when we keep adding to that system. And so if we can keep finding these creative ways to make different cases, whether it's the business case, the labor case, or somewhere else, I think it's going to be really compelling. And I think we have to be creative and be thinking about what are the different ways that we relay this information. Even for people who are Medicaid advocates, I mean, I find that Medicaid advocates are fighting for really this very same thing that Medicare for All advocates are. It's just they've been in this Medicaid fight for so long, right? In states that haven't expanded Medicaid, but we haven't created that language that connects with them. And so thinking of that and thinking of the way that we speak with different groups and what is most important to them, right? And explaining in a way that, lays out why Medicare for All is that answer, I think is going to be absolutely critical for us to really delineate over this next Congress and presidency.
Yeah, I know. So I grew up in Alaska. I actually worked for Alaska Public Health many, many years ago. And I know that in redder states, the concerns with Medicare for All, of course, are wait times. But there's also a big concern about health mandates. And I'm wondering if we can just talk for a minute about like coverage, what's covered, what's not. I think even though we say it a lot, I still don't think it sinks in because we're so entrenched in such a broken system. I've spent so many years explaining people's insurance benefits to very talented, smart people, and they get into an insurance bill and they're like,
Yeah.
it's very dizzying. So how do we kind of come across, some of the things that people are not connecting with, and how do we show them? I mean, is it dollars and cents? Is it, we know other countries do it better, but we still can't get people 100% on board yet.
I think this is such an important point, how important it is to always lay out the basics. I think I find that Medicare for All advocates are so well versed and even fighting for this so hard, and they're so good at understanding all of the different bits and pieces that sometimes we forget to bring up these just basic parts. And when I have conversations with people who don't know about Medicare for All, who maybe heard about it on the TV when some couple people, presidential candidates, were yelling about it on the debate stage, when you talk to them, it's very clear that the most basic understanding of it has not transmitted across to a lot of the public. And so just basic things of that it's not Medicare as is, right? This is an improved Medicare package, because you can meet lots of seniors who will say, well, I've had Medicare and my God, it's been a mess and I have to pay this insane deductible and it doesn't cover all the benefits that I need. And all of these, I have to get another plan just to fill out my out-of-pocket costs and another plan to cover right? Seniors know that. And it's the second that you explain, oh, totally, we agree with you. That's why we improve Medicare to include the benefits that you need and get rid of those out-of-pocket costs. It's a mind-blowing thing, especially the long-term care. We cannot underestimate how critical long-term care coverage is in this country, how so many with disabilities and our seniors are literally dying for long-term care, how their caretakers are sacrificing so much of their well-being and their livelihoods to provide long-term care. And so basics like that, just the fact that this is an improved Medicare, the kinds of benefits that it provides, how many people I've met who don't know that Medicare for All covers pediatric services. I mean, it's interesting. I mean, those things are just missing. And I feel like we really have to keep reiterating those points. We have to keep reiterating it is a comprehensive insurance package with no copays, deductibles, premiums, just like Melinda was saying earlier, right? And also talking about the other pieces. I remember when the presidential primaries were happening and this Kaiser poll came out and it said, what are all the topics you wish the politicians would talk about that are not Medicare for All? And it said reproductive health, mental health, drug pricing, and surprise billing. And I said, oh my God, those are all Medicare for All. And it's not coming across, right? This is a comprehensive bill, and we have to lay out all of those benefits that come with it.
Absolutely. Sean, would you like to jump in and tell us a little bit about Whole Washington and how this path forward is going to hopefully get us where we need to be?
Yeah, I'd love to. So Whole Washington is an organized grassroots organization here in Washington State with the belief that healthcare is a human right and that we need to get Medicare for all by any means necessary. Now, by how we do that here in Washington is that, like people have said, they just really don't care. And so what we have in Washington and many other states have as well is this great piece of legislation, this law that allows us to write, the people to write our own bills called ballot initiatives. And so ballot initiative, a citizen, an organization can write a piece of legislation, go around, talk to citizens, your neighbors, your family, your friends about like, hey, I want this thing. It's good for me. It's good for you. It's good for everybody. Let's get this thing passed. People sign it, and then it's voted on in the general election. And that's how we plan on getting universal health care for the state of Washington. Now, we're modeling ourselves off of Canada and how they won single payer healthcare for their whole country, is that they did it by province by province. They did it by Saskatchewan, and Washington wants to be the first in the country to show that Medicare for all works, that it's great for everybody, and that it will eventually lead to a nationwide plan. Now, why does Washington state need universal health care? Now, other people have said stuff, costs and things, but what are those costs? So as part of our state budget, in 1991, our healthcare was represented about 10%. It's grown to over 14, 15%. And what does that mean, on a statewide level? That means there's less money for schools, there's less money for roads, less money going into hospitals, things that you wish that were funded for mental health care, for building homes. All that money is going towards the health insurance companies and big hospitals. And so those are your issues, schools, education. That money isn't there because someone else, someone rich is taking that money from you. And I think most people know that times are tough. Working class people, they don't have a lot of money. Most of them live paycheck to paycheck and don't have $400 in their bank accounts for an emergency fund. I've been there myself, and it's nerve-wracking. You don't know, like, am I going to get in an accident? Is something going to break? And that stress eats at you. And so in terms of healthcare, the amount of our employee compensation has been going up and up, being eaten away by healthcare. Now, when I talk to my union brothers, I'm like, hey man, look, premiums have been going up every year. And that's when we go to the negotiating table with our contractors, they have to account for that. And so that's less money going into our wages. Imagine if we went to a single payer system, at least for my union, instead of paying $1,500 a month for premiums, we'd pay, about only $300 with a savings of $1,200 per month. And for 90 to 95% of Washingtonians, our bill would save them money. That's money that helps students pay off their student loans. That's money to save up for a rainy day, to save up for a down payment for a house, to, just afford some financial security and some breathing. So, that's those are the costs that happen with our current system and what we could shift into with saving from single payer healthcare. So our plan right now is to organize volunteers before we start signature gathering. We're going to signature gather through April through December. And then once that happens, we're going to have a whole year, because we don't believe the legislature is going to pass our ballot initiative. We're going to have a whole year to prep, organize, and get out the vote. So if you guys want to be involved, you can go to wholewashington.org and sign up to be a volunteer, donate. We need everybody, and I'm looking forward to working with you.
Awesome. Thank you so much, Sean. I gathered lots of signatures the first round, and I am so excited to push this coalition forward in so many ways that we can really make a difference. I'm driving my van around town with giant stickers on the back of it asking for support for Whole Washington. So I have that conversation everywhere I go. I don't go to a doctor's office or any medical facility without Whole Washington literature on me, my button on me, or my red beret. So we've got a lot. I know the campaign has a lot of stuff planned in the next couple of weeks, including, we thought this would be really awesome for after after this crazy election cycle, we all kind of need a break, and it's really good. And that's why we wanted to have this tonight also, is to really refocus our energy. Like, we don't have time to take weeks off and rest. We'd all like that. I know a lot of you have worked your tails off on campaigns and initiatives and, fighting for the good fight all over the country. But we have to get organized on this right now before our legislatures are back in session, and to get these signature campaigns going. So if you're in other states, check out onepairstates.org. And that will give you who's working on this in your state. I know about, I believe, 14 other states that are pushing hard on this same platform. So that it's happening in a lot of different places. And we're so proud of all of our whole Washington endorsed candidates. And as we know, it really doesn't matter who wins the White House. We know we don't have anybody supporting single payer healthcare. And that's a big deal. And so we need to keep organizing, and we need to keep working. And that's why we're here tonight. So please join up to collect signatures and to pledge. But one of the coolest thing I'm really excited about is we're going to have some stitch and bitch sessions. So getting together, learning how, we have some amazing crafters in our group, and right before the holidays, go grab some red yarn and we'll learn how to make red berets. You can have one for yourself. You can make ones for your family for the holidays. Just a relaxed, kind of decompression. I think all of us have had a long year, and I think we should work with our hands and do something that has so much meaning and learn a new skill. So, or if you're an amazing artist of fabrics and you'd like to join us and lead sessions, please let us know. Our Revolution Washington or Whole Washington. So I'd love to have that. Elaine, I would love, oh, yes.
Real quick, I just want to make sure, you said earlier, you said Whole Washington endorsed candidates. And I want to make sure that everybody understands that Whole Washington does not endorse any candidates. Candidates can come out and say, yes, I endorse Whole Washington, but our Revolution endorsed candidates all had to be for this. So I just want to make sure, because it's, that the distinctions are there.
That is a distinction. But we have many of them in the chat and watching online. And so we know how hard you guys worked, and we're here for another day, and the battle's not over, and we've got to get this going. But I want to hear from Elaine, like, how would this impact your business? How would this impact other providers? Have you heard resistance? Do you get to have these conversations around the water cooler?
I have a private practice, so unfortunately, I don't have much of a water cooler, network anymore. But I certainly do talk to other psychotherapists and other kinds of healthcare practitioners as well. And it's a conversation, definitely a conversation in terms of the people I work with, my clients. They are, a lot of people that I deal with or work with are paying through their insurance. And so they're watching as, insurance skims off the top, as how much of their money is going into administration, et cetera, as opposed to, treatment of whatever sort, whether it's physical or mental. And I guess the thing that I'm really cognizant of these days, there's a couple. One is how hard it is right now to get mental health services, particularly in a place like Seattle. I know a lot of people, I don't know anybody that has a open practice right now. Everybody is chock full. And so if you happen to be seeking services right now, it's really hard to find somebody. And of course, with everything going on, with the effects of coronavirus, all of the issues that have come up, the awareness about racial equity and people of color, Black people who have been dealing with the stressors of having watched somebody get murdered and, again, being in the streets and continuing to deal with these situations. It all affects, I'm not telling anyone anything they don't know, but physically, emotionally, we're all affected. Some of us way more than others, but whether I'm talking to other practitioners or consumers of mental health or other health care, there's obviously an awareness that we're paying too much, the outcomes are not good enough.
Yeah.
People, many people have studied this, but even if you haven't studied it, people have their stories of people that they know, perhaps people in their family or people that they've tried to give support or care to, who have, had to ration their medicine because they didn't have enough money to use it as it's prescribed, or people that have had to wait for important tests or other kinds of healthcare because they couldn't afford it, couldn't afford the giant deductibles or other things that sort of make regular healthcare actually turn into catastrophic healthcare that you can't use. So yeah, I run into whether it's practitioners or clients. As I said earlier, we all have bodies and we're dealing with this.
Absolutely. I know I have been impacted by almost everything you said, from police brutality to trying to get services, mental health services for my family has been incredibly challenging.
Yeah.
And I've been in medical and student debt peonage most of my life. So I can absolutely, I'm sure it's a huge stressor. We do, I have somebody who I'd like to ask a question. She actually, I met her phone banking and I'm so glad I did. She is amazing. And her name, she's actually, her name is Naomi Aldort, and I'd like to let her to ask some questions. Hi, Naomi, and I will ask her to unmute. It might take just a second. Hopefully she has a mic there. Hi, Naomi, are you with us?
Yeah, you can hear me, right?
Yes, hello, how are you?
Hi, I'm good.
Would you like to introduce yourself real quick?
Sure, I'm Naomi Aldort. I'm the author of Raising Our Children, Raising Ourselves. That's why you know me, right? And my book is in 19 languages and I speak worldwide. Now it's only on Zoom. My next trip to Europe was canceled. Yeah, so I work just as much and I care deeply about taking care of everybody. But I also care deeply about taking care of everybody in every way. And one thing, and especially, and I have following tens of thousands or hundreds of thousands of following worldwide. And I have a good sense because I would say probably 100% or at least 95% of my following do not use conventional medicine and still deserve to be covered. So my question is, are we working on, or I would like us to work on, making sure that it covers everything: naturopath, homeopath, acupuncturists, chiropractors, nutritionists, that one should be free to choose the healing mode that they want to choose rather than be forced to do the monopoly one that is just about suppressing symptoms while the body is getting sicker and the actual healing is not taking place, which is a short way of saying that suppressing symptoms doesn't work actually and does the opposite. So I'm 71 years old. I never used Western medicine once. I just don't. I mean, in my 20s, a couple of times and learned my lesson. And I always go to natural practitioners or finding ways that sometimes cost money as well. It could be something I found on my own, and I think people should be empowered to do their own research and say, here, I need a blood test and I need some MRI. This is what I have decided that I need, rather than you always need an MD approved by the manufacturers to tell you what you're allowed to do or not to do, or what test you can do. I think people should be able to get that covered when they say, I need a blood test, or I need x-rays, or I need this or that. But I want to take care of myself, not with medication, but with this. I want to do physical therapy. I had an injury, but no, I don't want surgery for my knee. I want to do physical therapy. I want to do, well, physical therapy they do cover sometimes, but that's a chiropractor, osteopath, yoga classes, whatever it is. So what are we doing about inclusiveness? And I don't mind if Washington State is the first one to make sure that we get not only everybody covered, but covered every way of healing.
Absolutely. I very much echo your sentiments in this, as somebody who has dealt with very severe illnesses and, felt like I was led down a very expensive rabbit hole, and work very hard now to do my own research. Would Sean or Stephanie, would either of one of you like to talk about this on a state and federal level?
Well, I'll start with, if that's okay, Stephanie, with the state level. So our plan does cover rehabilitation, and it covers acupuncture, some massage, and other healing therapies. What the great thing about Whole Washington and our bill is that we form a community committee that is responsible to holding hearings, meeting up with community members, and suggesting to the board that is created under our legislation of what benefits should be included and what the community is asking for. So unlike a private for-profit health insurance company where, you're like, hey, can I get this on my benefits? They're like, heck no, you're just a person. Whole Washington actually allows for some democracy, some community engagement to actually get more benefits. And we designed it that way because, it's a living document like our Constitution. What we have written might not be the best for in the future, and might need to be changed to meet the demands of the times. So that's how we're addressing. So in that way, we're addressing the issues that you brought up, Naomi. I hope that answers some of your questions.
Hi, Naomi. Thanks for your question. I have, I guess, two things to point out in terms of the bill. One, in terms of broader, I guess, practices of providers. You're exactly right that the way that our current reimbursement system for providers is very much driven in a way that is to, it's perverse, right? It's very much driven for either profit making or, wanting to prescribe or order unnecessary tests or surgeries, exactly like you said, so that the bill is higher. And so that's why the bill is not just about providing coverage for people, which I'll get to, but also about transforming that piece as well. And so it's about transforming the reimbursement system so that providers don't have those incentives, those pay for performance incentives or profit incentives. It's, a system that is driven by ensuring that the population, that people are healthier. And that's the number one incentive that is incorporated into the way things are practiced. And the second piece is that the bill is quite comprehensive in terms of benefits. I can't say that it necessarily explicitly covers everything you've listed. It does definitely. I know somebody already in the chat pointed out physical therapy, chiropractic, acupuncture, a lot of the services, if a doctor did find it necessary for you to use, which I understand your point in terms of having the patient autonomy. But I will point out that the bill does actually require the secretary, whoever the person is that creates this benefit package, to actually consult with complementary and alternative medicine people to create an other benefits package to cover those services. So they're not, again, explicitly listed out yet, but it does require the secretary to greatly consider and to incorporate those benefits into the package.
Absolutely. Rhonda, would
Yeah.
you?
There's a question. All right. Oh, did somebody answered one already in there? So we don't need to bring in Ava's?
I would like to add something.
Oh, go ahead. Yes. Before we move on to a question, please.
Yeah, can you hear me?
Yeah.
Yeah, I think what Stephanie brought up is a big problem that elaborates on what I said before. It sounds like even when we have other possibilities, you have to be approved by the money factor, the MD. So you have to go to the MD and then he'll send you to the naturopath or the nutritionist. I really think, I know it's far out, but I'm a far out thinker. I'm sorry.
No, I just want to correct you,
Always
Naomi,
on the leading
for a
edge.
second.
That we need a way for the citizen to be able to go directly, to choose to go to a naturopath, to choose to go to a nutritionist, to choose. When I say I never go to a doctor, I have about 100 medical books, natural healing books on my shelves. I've read each one of them and marked them and learned and made lists and changed my diet accordingly or fasted or whatever. I've healed some serious illnesses and gave advice to family members who did likewise. So I'm not here to pride myself about what I did. The point is, people otherwise we're doing a government who is the parent, like there's a system of conventional medicine. You have to go through that and get permission. The medical doctor here on Orcas Island, he knows nothing about diet. Why would he ever send anyone to nutritionist? And why do I have to ask his permission? I'm not a child. A person should be able to make a decision. Oh, I have this problem. I'm going to an acupuncturist. Oh, I have this problem. I would like to go talk to this nutritionist or a homeopath. So we need to work in including all of those and directly, not with a monopoly of the for-profit who know nothing about these things. And why would they ever send you anywhere else anyway?
Right. So I just want to reiterate the point that I made earlier, Naomi, about the way that the payment system is transformed in the Medicare for All system. So it does take out that profit motive. And then the second piece is that, sorry if I said it in a way that was that I misspoke, but it's not necessarily that you would go to a doctor and they would refer you if that benefit is approved and it is, like I said, for chiropractic and physical therapy or for acupuncture. You don't go to a doctor, get the referral, and then go to an acupuncturist. You just go straight to the acupuncturist.
So who is
so if that
approving
benefit is,
it? So when you use the word approve, what do you mean by approve?
I'm sorry, what was
You
approved for
said
what?
if that system was approved, what does that mean? Who needs to approve it?
That package, when they come up, the committee that's putting the
Oh,
package
approved,
together.
not for okay, sorry.
For everyone.
Thank you.
All right, so we have 2 questions in here. I know we're already like getting to be an hour, so probably just these 2. They might come together. So one was from Ava from earlier. How might the Supreme Court decision on the ACA affect public interest in universal health care? And what is Whole Washington's plan for after this decision is made? So I don't know if Stephanie, you want to take kind of the first part, and then Sean, if you want to tackle the second piece.
Yeah, I'd love to hear what Whole Washington has been thinking about this, because this is definitely important. And I think people have to recognize that even if when we get Trump out of the White House, this is still very much a thing that is happening, given who is on our Supreme Court now. And so, I mean, the reality is that if they do successfully dismantle or repeal significant parts of the ACA, I mean, it's going to create this sense of urgency for people like Abby. You described your story You know, people like Abby, people like I'm sure a lot of people on this call will suddenly have their health insurance threatened. And I think it will really bring to light just how fragmented and fragile our current system is. And I think this is what is really apparent by the way that the Republicans have been able to peel away parts of it, because it's this sort of piecemeal system that's been put together instead of this fortified, centralized system that you would not be able to pick apart like this. I mean, for example, you know, for my family, they live in Georgia, and I'm, you know, supposed to enroll them into a plan very soon, and on the marketplace. And I had just gotten an email saying that the governor of Georgia has now eliminated healthcare.gov. Not immediately, it will be in the next couple of years, but like, what does that even mean? Right? Like, how does that happen? It happens when you don't have a healthcare system part of your actual like societal structure, right? And this is what really Medicare for All is about. We're not just talking about passing a bill just to have healthcare for, right? We're talking about really ensuring that this country rewrites the way that we take care of each other. And that piece of that, just like Naomi was talking about, we want to talk about how we take care of each other and take care of everyone, right? And do it well. Healthcare is a key part of that. And I think that the ACA case in the Supreme Court will only highlight that. And I think that there's a strong case to be made that we can't just be tweaking it like that. And so I'd love to hear what Sean thinks.
Right. So from whole Washington's standpoint, we're going to go ahead regardless of the status of the ACA. Yeah, I mean, that's the gist of it. How we fund our program, we don't rely on any federal dollars. As a state, we have to make sure that our anything that we pass is already can be paid for. So yes, we have in our bill an ability to apply for federal waivers, but we can't rely on that. And that's why we were able to have our bill co-sponsored in the state legislature. And when we pass it, if there is a challenge, it will go to the Supreme Court, and we'll see what happens there. But I feel like it would be a little hypocritical, even though Republicans like being hypocritical about states' rights. And if they strike our stuff down, they'd have to strike out other states' healthcare plans like Romney Care. So from our viewpoint, we're going to keep on going. Amber, did you want to say a little?
Yeah. Oh, yeah. It's perfect. So one of the things that we need everybody to do is to sign up to get alerts, check out the whole Washington website, sign up to pledge to collect signatures. If you got through us through our Mobilize link, keep an eye on there. We are meeting weekly in Whole Washington Volunteers. We meet weekly with our Revolution Washington Bernie Kratz. We do have one more question too. So I want to make sure that gets answered, but I just want to say thank you so much for everybody who's been here. And this question and these questions about natural healthcare are so important. I really want to emphasize that these conversations and these plans do not come with mandates. There is no, you must go see Dr. Joe for 8 visits, blah, blah. You know, like this is just it's better healthcare than you have now. It'll cost you less. It'll cost the state less. It will save our state of Washington $9 billion in the first year. Do the math on that.
I wanted Sean to delve in a little bit deeper though on that piece about how we can go forward, because I don't think it was explained enough about how we can go forward without having to do those what did you say we had in there? We're going forward without having to worry about getting those plans rolled in. Can you explain how going forward, how we're looking at funding that piece without having this federal mandate or the federal, you know what I mean? My brain just went blank on that.
So how do we fund it?
Yeah, how are we going to be able to go forward without, you know, why aren't we so stressed out about what's happening there and going forward? We're pretty confident that we're just going to keep going and get things rolling. Isn't it about bringing in people on different levels and it's like slowly building it up? Is that how we're able to go forward with this plan? No, you're looking at me like I'm crazy. I know everybody was saying you have to have get federal permission to roll in some of the federal monies, right? Into that. And I know, and that's the piece that I know people are really worried about. But here, aren't we looking at bringing it up as a public option and people able to grab into it before we even have to worry about that, right? And building that piece up. Can you go into a little bit how that, you know, we're able to go forward without having that federal waivers piece in place? Federal waiver, that's the word I was
Yes.
looking for.
Our awesome nurse, Catherine Lewandowski, says federal waivers.
Thank you for the word. Yes, federal waivers. So, you know, because that's what everybody's kind of banking on. Like, we're going to need those federal dollars, you know, you think, to be able to really push this through to the state. How are we able to go forward without those pieces already in place?
Right. So how do we go forward without federal waivers? Is that the question?
Yeah.
Right. So let's say we pass it, right? So we pass it, and then kind of like the family medical leave, there will be a payment period where we fund it, you know, partially or fully, and then, you know, we enact it, and then people who are who can get covered automatically will, and then others who before it goes statewide, others can hop on. So if you're a union member and your union hasn't, you know, decided to put its whole trust into Whole Washington, individual people can buy into the program as secondary coverage. Or let's say a union votes on transferring their healthcare trust, they can throw all their money into the trust to help fund it, while everybody gets that comprehensive coverage, and then they get their cost savings. I mean, we pay for it through a payroll tax. Employers pay a tax. We have a capital gains tax that's higher. So, you know, in Washington State, our tax structure is regressive. So we wanted to make it, you know, a little more progressive. So there's like about an 8.5 capital gains versus a 2.2 payroll tax for an employee. And that 2.2 is a cut from their private tax from a for-profit healthcare system. So as I said before, 90 to 95% of people will earn tons of savings.
Right. Thank you. I just want to make sure people understood that there is like this level. So, you know, not
Right.
to bank just on this federal money, that there is a process that we are working on here. So thank you for that. Okay. Last question. Under the federal single payer system, how do you prevent the evangelical right from using it as a tool to regulate individuals' reproductive care, or from using it to prevent people from receiving homeopathic care? I know we discussed some of the homeopathic, so we probably just need to concentrate on that first part. Who wants to take that?
I'm happy to. For the reproductive care, I mean, this was something that's so important to Congresswoman Jayapal, and she didn't just include comprehensive reproductive care, including abortion services, family planning, et cetera, into the bill. I mean, she completely covers that in Medicare for All. She also went as far as to having a provision in Medicare for All that in technicality repeals the Hyde Amendment, which prohibits federal funding to be used for abortion services, right? So she doesn't just include it, she actually goes as far as to dismantle the federal blocking. Okay, I understand, but that if that happened, they would have to go through an entire process, right? It's just as hard as it would be to pass a Medicare for All bill, just as hard for them to also have to go through Congress and pass through and have a president, right? And so if we are in that place, my goodness, that would be unfortunate if, but once people have a system, it's really hard to take away, right? And I think that we've seen that even with something as unfortunate as the EC or previous plans. But if we have a Medicare for All system and we prove its success, which I know we can, it would be extremely, extremely hard for people to reverse that. And the fact that that's already baked into the bill, I'm confident that we would be able to maintain these critical pieces. And I also just wanted to touch on what you were talking about, Rhonda and Sean, on the state-based. Yes, of course, having access to federal funds would be very helpful. But I think there are just some critical lessons to learn, especially from the Vermont attempt, which wasn't really single payer. It's like a single pipeline, whatever. But, you know, the tax increases that would have been required to have this plan in Vermont was going to be less on average per family than what they spend every year. But still, that number was terrifying for people, right? There wasn't enough. A key critical mistake the government made, the governor and that Shumlin administration in Vermont made, was that they didn't engage the public enough on this. Right? It was a very technical process, and they didn't make sure that there was a community engagement, there was education happening, and that people were there every step of the way understanding what was the benefit that was about to come. And it seems like y'all are doing these kind of webinars. You're already, you know, doing way more than they did, but things like this and expanding that, I think, is going to just be so critical.
Awesome. So everybody's going to go out there and share this video, have the conversation with their family. You guys are fired up to make some red berets.
Start building your resolutions teams. We will help. We will help do resolutions, local resolutions.
Absolutely. And go check and see who's passed resolutions. And really the big part of this too is you need to hold our elected officials, if they, like Washington State, have had universal health care in their state party platform for 5 years. You need to tell them at every single opportunity you can that there's no need for austerity cuts. There's no need for tough decisions. I've heard a lot of that this election season. It's absolutely not needed. One bill already written could pass it all, and we'd have extra. Everybody'd be covered. We'd have so many more pieces of this puzzle and this nightmare that we've been living in for 40 plus years just gone in Washington State tonight. So I hope you guys are ready to fight with me, sign the pledge, become a reoccurring donor for Whole Washington, keep track of our events. If you're having, you know, I know I personally have had a hard time finding, you know, medical services and health services. You know, we all need to learn how to tell our stories. We all probably, anybody who's had traumatic health experiences probably needs Elaine's services. I know I have healthcare PTSD from literally fighting with doctors, fighting to pay bills, you know, all of it. It has really damaged our country as a whole. And it's time that we take control of that and take the power away from the corporations. And I think that's something that even the evangelical right, and when we explain how much money this saves, what good it can do, and that it removes that corporate power and puts it back into the hands of the people, I think that freedom loving piece is really what sells to people who may not necessarily buy into this. So I hope you guys can all just, you know, get ready to get your hands dirty and let's do this. And yes, Elaine, you have something to say.
Yeah, I was just thinking about that education piece and how important that is, just from conversations that I've had. And, you know, people have that knee-jerk reaction that says, oh, it would raise taxes. We'd have to pay for that. How are we going to pay for that, et cetera? And one thing that I don't think people think about is how much administrative costs and non-healthcare costs they're already paying for as a part of their insurance. You know, it's like, I didn't know that until I actually started having to interface with insurance companies, which, you know, I do in my work. And it's sort of like, God, I feel like I'm being pimped by these people because, you know, it's like they're in control. And, you know, they're taking their piece and using it to lobby, somebody said this, using it to lobby the legislator to make sure that we don't get real health care. And so the role of insurance companies in terms of how their money that we pay as premiums are actually used, I think needs to be really a part of this conversation about how will Medicare for All be financed and just be a better use of money.
Yes. Oh my gosh. So I have spent so many countless hours trying to explain people their plans, and I could sit there and say, 5
You know,
visits of this
you know.
cost you this on whole Washington. It would be $250 a month max. If you're making 200 grand a year, like
Mhm.
it's just, it's so radically different that people have a hard time wrapping it because they've made it really difficult to understand. And parts of me sometimes even think that's maybe because they make so much money off of us not understanding it. So anyway, I think we're about done. We're quite over time. And I just want to thank everybody for joining us. Elaine, you are a healthcare hero out in the field every day and working on our mental health. Everybody knows we need that this week
Just
more than
one of
ever.
many. Yeah.
I want to thank Naomi for asking really great, important questions. If you haven't seen the movie, we are going to show the movie A Power to Heal again. And I would also like to add on to that, another movie I'd like to show is called Doctored, which talks about how the AMA really did try and take away a lot of rights for alternative healthcare providers. And we're still fighting that every day. So, Sean, do you have any last words for whole Washington, and Stephanie for Representative Jayapal's office? Congrats on the win, my old district.
Yeah. If you want to win on climate change, if you want to win on Black Lives Matter issues, if you want to win on, education for all, our campaign for whole Washington is just the beginning. It will show people, how progressive ideas will save people money and benefit their lives, and prove that the other issues are just as valuable and will greatly benefit everybody. So please join our campaign, wholewashington.org, volunteer, donate, and just let's empower people to take matters into their own hands and create the world that we want to live in. One that cares about everyone, treats everybody with dignity. Yeah.
Yeah, I want to echo everything that Sean said. And, I think this pandemic has not only shown the lack of health security in this country, but really social protection overall. And I think across the ideological spectrum or political spectrum, people have felt this intimately. The case has really been made, and all of the things that we're fighting for, they're not progressive. They're just the basic rights that we would want in a society to be able to thrive and live. And so I think, really internalizing that, especially, I think, we're seeing the results of this election, and I'm already hearing from some Democrats this rhetoric around, well, we lost seats in the House because the left was too left and we got associated with that. I love how everyone shook their heads at the exact same moment. That was beautiful. But it's crazy. I mean, they're just like, yeah, because of socialism. And it's like, my goodness, like literally I can't believe still how effective politicians think the word socialism or anti-socialism is. And so just, you can say that all you want and try to blame the left, but there's a reason why the Dems who didn't make it were all centrist Dems. And we have people like Cori Bush, who was just elected into Missouri, right? Like, it's pretty red place last time I checked. You have someone like Katie Porter, who was able to beat by a huge margin in a district that was red for the last couple decades, right? So I don't know, like, don't tell me that people don't want progressive priorities. $15 minimum wage is passing in Florida, right? And so there's just disconnect. I think that what people are really wanting are just politicians who are truly going to fight for them. That's what they want. And of course, fight for things that are going to improve their lives. But I think that's what progressive champions are. And I think that that's each of you who have just stood by this really important issue so strongly. And I'm so thankful for that. So just please keep up all the work. We're so happy to support everything you do. Thank you for supporting our office. And let's keep going. This next Congress is going to be crazy.
that does lead into our revolution plan. Rhonda, do you want to talk a little bit about the plan? Obviously, growing the squad. Just give a little two seconds.
Well, when we organize, we win. I mean, that's pretty much our plan. You know, organizing, of course, education, but yeah, grassroots, like we were talking about, it needs to really be coming from our local communities. Going to our city councils, and you know, like Sean was saying, you know, in Canada, it was just, you know, bit by bit by bit. We can do it here, and Washington is prime for the win. We really are. So, you know, even if you don't live here, we can use your help. We can get this done.
Yes.
I'm not going to tell all of our strategies, though. You need to join in to really get all the goods.
We got work to do, and we're gonna have fun while we do it, and we're gonna keep educating people and having these conversations. Just get yourself a button. Check out the Whole Washington merch store. You can get a Medicare for All mask, t-shirt, wear it proudly, join the Stitchin' Bitches, join in on some of the fun, because we, especially, like, you know, this has been a rough year for us all. So we need to have some fun, and we need to focus forward and get to work. So thank you all so much. I know Oz has a little music, and we'll have a great night. And thank you again for joining us, everyone.